Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Oh, Dr. Mencia. If only they had television on us right there. We'd never be able to.
They will be programming everything that we do off the air.
That's right. Well, I was asking Dr. Mencia about my feet because I do get these, I think it's my shoes. I do get calluses on my feet, right? You
Right.
just looked at my feet.
Yeah, I just finished
my goodness.
examining both of you.
Yeah, both my feet.
Yeah. And normally we don't think of a podiatrist. We don't think until we are in trouble. We have a bunion, where toes are turning sideways. But, again, if you believe in my philosophy of preventive care, it is wise to see a podiatrist. And the podiatrist will take it just by examining, like I did examining your feet, and you thought you have no problem.
Right.
And you have a little callus there on your big toes.
On both, right.
On both big toes, which means what that is telling me is when you walk, your weight distribution is more forward than what it normally used to be. And as you step, most of the weight distribution end up landing on the big toes.
Huh.
And that's important because
As compared to where would it land?
All toes up front. So when you distribute, you have 5 toes and you distribute them on all 5 toes, they're all cooperating to carry your weight. But if you take one toe to take, let's say, 90% of your body weight every time you step, and there's a lot of steps you do throughout a day and throughout your life. So eventually what will happen, the callus is only the tip of the iceberg. The next thing is the bunion. Because the bunion is when the joint where the big toes attached to start giving way and start, hypertrophy growing. So you get this big lump on the inner part of your toe. That's called a bunion. Petit bunion is when you have it on your outer part. And the bunion basically come as a consequence of how we move those toes and how much pressure we put, whether toward the front or back.
So excuse me, so if I come to your podiatrist, because you have 2 wonderful podiatrists, what would he or she, are they women or men? Or
Both.
Both
One
are
of
women?
each, whatever you want.
Okay. I don't have a
choose.
foot fetish. That's okay. Okay, so if I went there, what would she, for instance, do to help me then with my feet?
It's interesting. I was developing a little callus on my little toes, and I'm on my feet all day. And, I go and get my pedicure twice a month and what have you. I take care of my hands and my feet. And she started cutting my nail. I said, but I got to get my pedicure. He said, no, we need to make room so that the callus, and the nail can be separated. And then so I didn't know that. So she started cutting my nail, and then she went and cut the callus, and she did that a few times, and I'm so much better.
Okay, well, I'll have to make an appointment to do that.
But you can also check your feet at home. When I told you to check your feet, you look at your feet like that with your. Yeah. That doesn't to check your feet. You have to bend your leg. Right. And bring your feet open, open, and then look at the bottom part. Look at the sole of your foot.
Right.
If you cannot do that, if it's hard, take a mirror. And then with the mirror, you can also take a look for people that cannot bend like you and I are doing right now.
Right.
Take a mirror and take a look. Because remember, a lot of times when we get melanoma, you might get it on the sole of your foot, and you don't even know you have a melanoma. Now, if you go to a podiatry and they check for melanoma. They check your skin. They are doing a complete physical examination from your knee down.
Melanomas on your feet.
Yes, and there have been several cases we have diagnosed and basically saved the life of the patient, because melanoma, as you know, is one of the most aggressive skin cancer. And one of the patients that we had, you won't believe where she had the melanoma. No, not there. Between.
Well, you can have it. Can you have it anywhere?
You can have it anywhere. Melanoma, you can have it anywhere.
So it doesn't come from the sun necessarily?
Not necessarily. Just get, some people, they go to the sun and they expose, of course, most of the body. And some people go to naked beach and expose themselves completely. You can have melanoma anywhere in your body.
On your feet.
And she had it between her toes.
And what does it look like? What is
it's
it
a little black spot. A little black spot. She was lucky because it was right in between her toes, but it was in that empty spot there. So it was away from the bone. Because as you know, in your toes, there's not much distance between your bones and your skin. So any melanoma that penetrates the bone, you can just, kiss it goodbye.
No kidding.
Because it will travel like there's no tomorrow.
So
when you
everyone needs to go to the podiatrist,
you
right?
need to go to your podiatrist, do it preventively, just go and get checked. They will tell you, I'll see you in 10 years or I'll see you in 3 months. Now, who should, and I encourage my patient in my practice, because I have 2 podiatrists, I have 2 dietitians. So I encourage all my diabetic patients to go at least twice a year or 4 times a year, even better. Why? Because with the diabetes complication that we know about diabetes, well, we see 3 people: the eye doctor, the dentist, and the podiatrist. And then the nutritionist and we are the gatekeeper. But the consultant that we want to keep is your dentist, because, your teeth were meant to live for thousands of years. You will die and they will recognize you because of your teeth. So your teeth are meant to be there for thousands of years.
But I have to interrupt you. Do the mummies have teeth?
Yes. Yeah.
Never thought about that.
I think it's like up to 3,000 years, teeth can survive the environment.
So the
bones are gone, the skins are gone, blah, 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 but the teeth are meant to be there. So, if you have diabetes, of course, you can have gingivitis and you can have inflammation. Then you start losing your teeth. If you're a smoker, smoking tends to produce gingivitis. So if you are a smoker with diabetes and you don't get your dental care, you don't go and see the hygienist, the hygienist in my practice, the way I have the department set up is that the hygienist and the dentist work hand in hand. There are practices that you go and you only see the hygienist and you go home. But the hygienist and the dentist, they work hand in hand. So whenever there is a concern, the dentist get called in, and there's no charge to the patient, but we make sure that we try to, do the philosophy of my center, AGI, is preventive care. What can we do? And I went to a program, not to get off the subject, but I went to a program, and they were talking about, well, with Obamacare, this is how we can do the care of the patients, so we can save money, and we can take care of the patient and prevent hospitalization. And I went there with my managers and other physicians, and we are sitting there, and we all look at each other and say, we've been doing this for 20 years already at my center, so we should be the model.
You should be the model. I do agree. I know that holistic care has always been your motto. But I want to get back to the podiatrist. So when someone comes in and you're examining them, then you would then direct them to your podiatrist, because you...
Right.
And then the podiatrist...
They will spend a lot more time. It's like, I advise my patient on diet and what have you. I advise because, I follow a healthy diet. I'm into sport. I teach martial art. And but I tell them, the dietitian is going to dedicate an hour time that I don't have to sit down with you. The podiatrist is going to dedicate their time, their whole visit to your feet to examine you. And she does. When I go, because when I see my podiatrist, I see the female one. I love girls. So I see the female podiatrist. And when she examines, I watch her and she check my pulses. She examines my skin. And it's the little calluses that she's going to take care of. But she always just like a reflect. She just go and do her thing, and boop, then she go and take care of my calluses.
Okay, but and so Medicare will pay for all this, won't they?
Most insurance will pay for podiatrist care, not only Medicare. Medicare and most insurances will pay. Even the HMO that, I'm so against those HMO and the way they treat patients. I have very few HMO and I choose them. I handpick the one I work with. But even HMO will allow you to see a podiatrist. Because they know the cost of taking care of a person that needs an amputation is going to be a lot more expensive than just seeing a podiatrist.
Well, I am definitely now. I just came back. I had my. You're very proud of it. Besides my flu shot, I just had my pneumonia shot, and now I'm going to go down there, and have the podiatrist look at my feet and do what she can. And when I was there, that lady that does she said, I want to check your
circulation.
No. What's the thing about the plaque in your neck? You have something that you check.
Oh, the ultrasound.
Yeah, she said because she had helped me with other things there. So she says, I want you to come back so I can check it. I said, okay. Yeah. So I guess I have to go back. But I'm very interested in the podiatrist. I've never had a podiatrist. I dated a podiatrist.
Oh, really?
After I was divorced, I dated a podiatrist before I met Bill.
And you say, no, you're too low.
No. That's another story we won't talk about on the air. It was just so funny. Oh, that's a funny story. Yeah. I'll tell you probably sometime. But it's funny because that's not been something that I've thought about. And I'm glad we're talking about it. I bet there are a lot of people sitting in your home right now or lying in your bed. When were you at a podiatrist last? So I'm going to insist you do this. You're going to go see Dr. Andy Mencia's podiatrist. And, of course, it's AGI Medical and Dental Centers. They are open in Fort Lauderdale on Saturdays. And you can call them for an appointment for the podiatrist, 954-489-1345. Of course, you know that they have opened another wonderful, beautiful office in Boynton Beach. If you want to make an appointment in Boynton Beach, and the reason that Dr. Mencia did this is because when we started working together, we had a lot of people who were traveling from Palm Beach County to come down to Broward. Yes. But now he opened a beautiful office up in Boynton Beach.
State of the art.
Off A. Hagen Ranch Road. And the number there is 561-270-6494. And the other thing, their website, go on their website. It tells you a lot of things. It's agifl.com. Something that I'm very proud of Dr. Mencia for doing. He has a fantastic home visit service available for homebound patients, and Ina is working very hard at helping in that area.
Yeah, she's doing it. Well, the whole staff, Ina, Tina, Oscar, Nadira, there's a team working together.
And they go to visit people at their home.
They set up, they do the management. They are the backstage people. And then we have the medical doctors and nurse practitioners that will go to the home and do a home visit. And we're getting so much popularity now that the team is covering Tri-County.
Fantastic.
They're covering from Miami-Dade, Broward, and West Palm Beach.
I am so proud of you for doing this. Yeah. I've told you that it makes my heart sing because so many people are lying in their beds at home. Nobody cares.
I had a representative from one of the hospitals that came and say, you should come and market this to us. We need it so bad because now, if the patient gets readmitted to the hospital with the same diagnosis, the hospital get tagged. They end up losing money.
You're right.
So they want to make sure the patient is well taken care of. So I say, no, I'm not going to market anything, not yet. I have to be ready because I'm not going to look bad in front of the community We're going to keep opening gate as we grow, and we can take on more work, then we'll do it one step at a time. So I'm trying not to rush so we don't do a bad job. So somebody that call and let's say suddenly we get 50 people calling for home visit that are homebound, we want to be able to provide.
You could get 50 people calling. That would really
we've been
overwhelm
getting,
you.
yes. We had a company that saw the services that we were doing, and they heard from the patients. They say, oh, the service, Dr. Mencia is doing to us. They come and draw the blood, they do the ultrasound, they do whatever we need, and everything get done in the house. They even come and do our ear lavage if we need that. And the company call and they have like 30 patients. They say, we're going to give you our patient. You're providing it much better. And that was very humble, I think, of that company to do that.
It was because
they see, wow, these people are so organized. Whatever they are doing it well. So they just step aside and the doctor call and say, take over.
So people go there they don't go in a van or anything. They go in their own car.
They go in their own car and they go one
equipment.
patient at a time. We take the equipment with us, and the phlebotomists also go, the sonographers will go, whatever. Always the same philosophy. Wherever we go, let's provide the equal service regardless of what your location is. If we go to a nursing home, to a retirement community, or we come to the home, let's provide equal services. And the podiatrist also.
That's what I was going to ask you. Will the podiatrist
go too? The podiatrist will go and do a visit. The dental department, if the patient have lost their teeth or has a dental emergency, they can go in and do an assessment and see how much can be done at home, or if does the patient need to come. There was one patient we went to see, and the work was so intense that we called the daughter and said, no, you need to come in, and we're going to put her under sedation so there's no suffering. And by the time she wake up, all her mouth will be done.
That's so important, Dr. Mencia, as you said before, that as one ages and they're not comfortable with their teeth, they start to eat soft food and then they don't even want to eat.
And they die.
Yes.
And they die prematurely. We lose so many loved one prematurely because, we need to get our head out of the sand. We need to get our head out of the sand. And if there is a problem, just face it head on. There are solutions, and we are there to help. We are there to be part of the solution. And, we have a few home healthcare agency and companion company that we work with. We have access to social worker when that is needed. We had a patient that was struggling with an HMO at home, and she couldn't get any service done. She couldn't get her power wheelchair. She couldn't get anything. So the social worker went in, and she will qualify all the way for her Medicare, Medicaid, and a prescription program. And the HMO would not say anything because, of course, they were, milking the poor patient. And she got everything, and then suddenly the power wheelchair just right another, boom, it was there. Her bathroom was fixed so that she can shower. And, all those things that we all take for granted, a lot of these patients that are homebound, they need help. They need to be, and it's a biopsychosocial issue. It's not only medical. So when we go there, we sit down with all the providers so that they understand, because a lot of these nurses, they finish their program and, they've been doing nursing all their lives. So I usually tell them, take your family life experience and your nursing experience and put it together, and you're going to be a great provider.
That's beautiful.
Yeah.
Dr. Mencia, are there a lot of people living alone in these situations? Are people living alone just trying to take care of themselves?
There's a lot of people living alone. There's a lot of dynamic going on. There are elderly people that are afraid of their own family because of exploitation, abuse, neglect, and what have you, financial exploitation. So they rather be by themselves than be with their own family or their own kids because, they feel that they need money for them to survive and live. And, and it wax and wane the abuse of the elderly. If you notice when I'm an expert witness in a lot of geriatric cases. And when we have the economy that went down, unemployment was, off the roof, elderly abuse and neglect went up because those kids that couldn't find any, a way to survive, they either move into the house or they will go back to the parents and say, open the bank account, I need your money, or let me see that check coming at you. So, we have, as a society, we have to look out for our geriatric patient,
Well, that's why you are a geriatric physician, and people have to understand there is a difference in a doctor who takes care of older people and someone who's been trained to take care of older people.
Exactly.
And I want people, and there are not a lot of geriatric physicians. In fact,
there are not a lot in this country. We are underserved.
Yeah, I just sent you something that's saying the medical schools are not educating people to go into geriatrics, and I have never understood that.
And geriatric medicine and community-based medicine, a lot of program. I even spoke with my administration. I wanted to start a training program in my center because the program that we have up to today, they are hospital-based program. If you notice, a lot of the residency program that we go through after medical school are hospital-based. They are not community-based. But when we finish all of this, then we go to the community to become doctors. But that's why we have a tendency of seeing a patient and say, oh, you have a UTI, maybe we should go to the emergency room. No, you don't. I had a mother and daughter that came to see me last week, and yesterday was the last visit. It was 4 visits from last week to yesterday. And on each visit, when she came, she has bronchopneumonia. And she say, very adamant, I am not going to the hospital. Now, if you are trained that hospital is the way to be, of course you're going to encourage the patient to, oh, please go to the hospital. You have to go. You're going to die. And I told her, okay, we're going to treat you as an outpatient, but you're going to have to come to my office. Well, our office visiting nurse, they declined. They said, no, we don't want the nurse. We want you. And I said, well, I cannot come to your house, but you can come to me. And, we set up the appointment every other day. And we did a injection of antibiotic in her tooth 3 consecutive times, plus oral antibiotic, plus a little prednisone. And yesterday I saw her. She was like brand new, brand new woman. I said, we are out of the wood. We have overcome this. Just finish your oral antibiotic, and I'll be, of course, today I'll be seeing patients. So I'm here on Saturday if you need me.
Amazing. And see, keeping her out of the hospital, the emergency room, that's
of course
so important. People,
you go. I don't know if you've ever been to an emergency room
I have been.
As a patient.
Oh.
But I cut myself one and I went, but they gave me the VIP treatment, so it doesn't count.
Well, I didn't get the VIP.
So I went right in. They put some glue on my little cut and blah, blah, blah in my finger. And
I have been there with my mother, and I've been there with other people, and they lie in these, they get them in now a little faster than they used to, but they may be on some sort of a bed waiting, and it's all right if you have a family member there, but most of them are there, they're cold, they're waiting. It's very hard.
And, nobody knows you better than your primary care doctor. If it's something that your primary doctor, I even, go against going to this urgent care center. They charge the insurance almost like a hospital, like an emergency room. But they don't know you. You're going to a place where, if you are traveling and you need to see somebody, you can go to an urgent care center. But if you're a geriatric patient, you can also look around. Let me see what is a geriatrician. A lot of people that are educated, they will do that. They will call the hospital. I guess sometimes some of the local hospital calling me and saying, we have a patient, they are requesting a geriatrician, so can we give your name? It's one of the snowbirds. I say, okay, sure, send them over. And they will come in, and it's interesting because if they become winter traveler to Florida, then they become my patient.
Of course.
And a lot of those patients that travel, what we do is when they are here, they bring the record of what was done in their state. And when they go back, we give them records. So there is a communication, there's continuity of care.
Listen, Dr. Mencia, I just have to tell you that there isn't anyone that I've ever raved about more about you, because you're so your humanism is almost as good as your medical practice. Wow. I mean, you combine them. So let me tell everybody again, if you want an appointment, go down and get a podiatrist to take care of your feet. I'm going to. The phone number to call in Broward is 954-489-1345. Let me just tell you, if you get online, if you can't have someone help you, go to YouTube and go to Boomer Times Presents, or just put in Dr. Andy Mencia. You will see so many wonderful, wonderful interviews that you've given. You have such a great array.
We have covered the entire body,
really,
and
now my feet. We never talked to my feet before. Yeah. Now I'm feeling I have to go.
Oh, by the way, the podiatrist does come on Saturdays. So he does Saturday once a month. He will come on Saturday. Okay. Just like the dermatologist, will do Saturday, because sometimes the kids that hear the program, we have a lot of young boomers that listen with their parents.
Right. Make sure that you get an appointment for your parents and for yourself.
If you work and Monday through Friday, it's hard for you to come, you can come on Saturday.
I wish everyone could see. And I have to take a picture of Dr. Mencia. We're going to go to our next show.
With my scar.
Oh, with your beautiful scarf.
Me and Richard met each other down there with the scars.
Yep, I got that. I got that. Thank you very much. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.